The Stephen Handisides show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.
Welcome to the Stephen Handisides Ultimate Beauty Show. Step inside my Ultimate Beauty Clinic and discover a world where the very best aesthetic, beauty and fitness experts will be demonstrating to you just what can be achieved, whether you want to look younger, change your image, get fitter or sleep better. Regrets. We've all had them, and if that includes having a tattoo and now you want it removed, then keep watching. As well as this, we have some cutting-edge treatments, including a non-surgical nose job and some remarkable developments in dentistry. There is something for everyone on the show. Let's take a look. We're here in the cosmetic clinic where all the action happens. We've got 3 cosmetic doctors and 3 very different treatments. First up, I have Dr. Anita Sternum. So what's happening here?
So here we have the Exilis Elite, a safe, FDA-approved non-surgical device that can be used to remove fat from the face, neck and body. It can be used to tighten the skin and to improve the quality of the skin. What we're seeing here today is actually a skin tightening treatment. This device uses high energy monopolar radio frequency and ultrasound. Here we're seeing the device actually heating the top layers of the skin, and this heat actually stimulates collagen remodeling, which in turn tightens the skin and helps to reduce the appearance of fine lines and wrinkles and also saggy skin.
So when it goes on, does it plump it in any way?
So what it does, it tightens the skin. So we all have collagen in our skin. As we age, we start to lose this collagen, and this makes the skin slightly looser and saggy. So by stimulating collagen remodeling, the aim is to actually tighten the skin, improve its elasticity, and in turn it helps to reduce fine lines and wrinkles.
So would patients come back for a series of treatments, or is it
They
a one-off
often
treatment?
come back for a series of treatments, usually 4 to 6 treatments, 1 to 2 weeks apart.
Great. And how closely can you get to the eyes? Like,
So
especially,
you
for
can do, as
all
you
of
can
us?
see here, we are treating all the way around the eye. We call this the periorbital area, and it's actually quite a safe, effective treatment to use in this region.
Would you do less, say, injectables if you were doing this?
The idea is actually you could use this on its own to actually improve the appearance of the skin. It could be used in conjunction with other treatments like Botox or fillers as well.
Okay.
So there's a great treatment for you for facial rejuvenation. Right, we're going to go over to our next expert.
All right, thank you.
Now we're here with Narushka Enriquez, located in Harley Street. Now this looks like a very interesting treatment. So
This is amazing. Did you see, just even the little bit that she's been doing, it is crazy to look. Wait till you get up and see what she did. But look how it's just straightened out the entire nose.
So what are we doing here? I mean, are we doing a treatment for the nose? Because typically we all know that if we are going to correct something on the nose, we always think of nose
Yeah, like surgery.
nose job surgery.
Yeah,
So what are we doing?
absolutely. It's just like that, except we're not going under the knife. So we're not opening the nose, and we're just doing some simple injections to just manipulate the shape of the nose and perfect all the little areas where it's a bit, unsymmetrical, to make it straighter from the profile and looking at the nose straight on. And we're also going to lift the tip a little bit. The tip's a little bit going off to the left, so we're going to straighten that for Isabella. And we're also going to correct this little area below the tip as well, so that we have that consistency going all the way through the nose.
So is this sort of the typical patients for this? Obviously I've got like a bump, and I think there's a lot of people like a bump. So this is a great treatment if just to soften things and smooth things out. Is that right?
And
Absolutely.
And if you did, like, if you tried to smooth the bump, would it make your nose larger? Or would it be, who would you prefer to do that? And in what way?
It's an excellent treatment for nose bumps.
Okay. So we both have bumps.
yeah, sorry, we're asking about ourselves actually. Yeah.
They're very
It's all about
common.
us.
They're very, very common. Everyone seems to have a nose bump.
I know.
But you know, the wonderful thing is that it's treated in about 10 to 15 minutes. It doesn't
surgery,
make-
swelling.
Yeah, absolutely,
Yeah.
absolutely. You know, you don't have that downtime. Next day you can just resume your normal activity. Nobody's going to know. You might be a little bit swollen, but that can be managed. And you know, it's just not an obvious thing and not so disruptive to your everyday life.
Would you say
Yeah.
the only negative thing would be like someone would have to come back and have top-up treatments versus, you know, surgery, which is more permanent?
Absolutely. I mean, you do have to maintain it, but each
Like going
time.
to the gym.
Each time, yeah, it really is. You know, each time you maintain it, you get something that stays with you, and that's all the collagen that stays behind. So it never really reverts back to its original state. And you know, each time you maintain it, you do it less frequently too.
So this is using a hyaluronic acid filler.
That's right. Yes.
You've treated half the face so far.
Yes.
Okay, so we're really excited to see the results. We're going to come back to you and see
looks-
the
It's
see the final
incredible
result.
already. Okay.
Great.
Great.
So, now with Dr. Beatrice
Hello.
Molina, you're
Hi
doing
there.
a anti-aging eye treatment, would that be right?
Yes, it's one of the most popular treatments at the moment. I think a lot of people don't realize that it's a possible treatment to be done. We got a beautiful 43-year-old lady who looks really good for her age. She has no treatments before, and she was just telling me that she looked a little bit tired, and it's what we call it a tear trough treatment. So, which is just the line which goes from the middle of the eye and it crosses around your cheek, and it just makes us look tired even when we had 12 hours sleep. So what we do is a very simple treatment. We do a very small injection, as we can see in here, on the cheek, and we just do a very little amount of lidocaine so it doesn't hurt. Then we put a very small needle to do an access point, and we use a cannula, which is like a blunt needle, and we can access from here all the way up to here very safely without causing any rupture of any of the major blood vessels or any damage to the nerves. And then we can just place the product along this area to increase a little bit. Because as you can see on this side, if you look inside here and we do that little push, what happens? Disappears.
out, yeah.
So it's really a little bit of a mid-face enhancement.
What about the bags under your eyes? You know how you see a lot of those people and they look tired? It's not the panda eyes, but you know, the fluid
It's
under there.
slightly different, but
Okay.
it's really effective, and it will be my second choice on her.
You
So
would
once
fill
you
in
feel
here?
the tear trough and you got the support of the arch of the eye, then we go very carefully and put the product along that rim, just very subtly, and then just lifts up.
So how many treatments would someone need to have in order to correct that?
If you are experienced, you can do it in one treatment, but it depends obviously on the patient. Sometimes because of the elasticity of the skin, and if we got a little bit more mature skin, we do it over 2 treatments just to make sure we put a little amount, let it settle, and then we can put a little bit more afterwards, because obviously the patient is happy as well. It's not been too much work done in one go, and you are creating what we call it a sandwich technique. So you just really, like an scaffolding, you're putting a good base and building up very, very gently.
So you've treated one side of the face?
Yes, we're doing a
Yeah.
little bit, it's nearly finished, but we can actually have a look, because this was actually her bad side. So this was the very worst. This one was not very bad at all, and normally we're supposed to start on a bad side because it's obviously easier to match the other side. So we're just doing a little bit so just to see what it is
Okay.
about. But it's not totally finished, but it's good enough to probably have a look.
Great. So, okay,
Yeah.
Penny, do you want to just sit up for
Yeah.
us so we can
So
see?
we can just see
And how
here.
long will it last now?
About a year.
So she's got a full
Normally
year on
after
that.
1 year we do a little top up.
It's a
And
reasonable
we put
treatment.
less than 1 mil at the moment, so it's a very small amount.
Great. You can really
You
see a
can see a
difference there
really
between
good
both.
difference,
Yeah.
particularly on the
Yeah, look at
subtle
that.
side profile.
Great. And how much would this
So look-
cost? This type of treatment?
Around £650, depending on obviously patients and amount of product used, and obviously physicians' fees.
Great. Well, thank you so much
Yeah,
for
love it.
showing
You're
us
very
that.
welcome. Thank you so
Fantastic
much.
treatment.
Great.
Right. Let's go back
Good.
to
Thank you.
Narushka.
Each and everything is just so different.
It
And
is.
how
I'm looking
subtle.
forward to seeing the result.
Yeah, this is still amazing to me. Like if you look from this angle, it's completely straight and it was curved. I'm not quite sure how you did that with fillers.
All right. Should we sit up, Isabel, and see
Yeah,
the
sure.
final result? Yeah.
So, Isabel, sit up for me.
Wow. I mean, you can really
It
see
really is
the
something, huh?
result. Narushka, just basically summarise what you've done there.
Okay, so what I've done is a few different things. We've actually straightened the bridge because there was a little bit of deficit of volume above the bone here in the center of the nose. This is what we call the bridge. So this has allowed Isabel to achieve a really nice straight line. There's still a curve.
And it tipped up a little bit.
Absolutely,
Yeah,
lifted the tip. And also there was an asymmetry just above the tip where one side was a bit flat and a little bit low. So we've evened that out, made it symmetrical. And just below the tip, if you lift your face, Isabel, we've actually done some injections just here, just to straighten up that tip, to lift it up nicely and give you that nice line straight down the nose.
That's really, really impressive. Thank you
It's really
so much
something.
for both of you coming
It's
in. You've
really
done,
beautiful.
You've done well.
Yeah,
So
it's
if
beautiful.
any of you at home are really interested in any of these types of treatments, go onto the website myfacemybody.com and you'll be able to ask the experts all questions about these treatments. Here on the Stephen Handisides show, we love to bring you the ultimate patient transformations. Now, I've got here Dr. Julian Kaplan, one of the top UK cosmetic dentists to the stars. So, what are we going to be seeing here today?
Well, we're going to see new technology. The technology has been around for maybe since 1985, for quite a long time, but really I've developed this system to allow us to provide one-day smile makeovers. So patients can come into my practice and within 4 or 5 hours from start to finish, we give them a new smile.
Great, well just sit on this first visual here, tell us this sort of 3-step process.
So we have a scanner, and the scanner is about the size of my finger. Instead of putting that gunge material in your mouth, we use a scanner, and we scan around the teeth, and that information gets put onto a computer, and then the computer, I can design the restorations, and then we get some porcelain blocks, we put them in a milling machine, we mill it to incredible accuracy, and then we glaze it in an oven, and then we bond it onto your tooth.
Sounds like baking a cake, but let's have a look at some of these images here. Just speak us through to the viewers.
So this is a bit techy, but this is the software where we've taken a scan. I've taken a scan of a model just as a demonstration, and here we've got an upper and lower scan with a bite. We put the bite together to allow the teeth to come together in the correct position. So just click to the next one, Steve, thank you. And then if we go to the next slide, you'll see I'm just marginating around the tooth. We're just showing the computer where to put the restoration, and with one click we get this restoration made, which fits the bite, quite amazing. Then we go to the milling machine and we put a block in the milling machine and we mill away.
So let's just talk about just a couple of the case studies that you've got here. So this is obviously with amalgam fillings, you can do that.
Yeah.
Yeah.
So everybody hates silver fillings.
Yeah.
And the silver fillings also cause cracks in teeth, and so there's some good reason for taking them out. And if we're going to take them out, we want to put something really good back in. And these are porcelain restorations done in one visit. About 2 hours later, from start to finish, we get beautiful restorations, long-lasting restorations, which look like teeth, not silver.
Well, this is the final case study here, and I just can't believe someone can walk out the same day with these teeth. It's absolutely amazing.
Well, I mean, same here. I get like hairs on the back of my neck when I see this sort of case. Patient comes in, I can see where I'm going to go with this case, and she came in, and at the end of about 2 o'clock, we fitted that case, and she was just, I mean, there's tears of joy in my practice. We get lots of hugs. Lots of hugs.
We all like hugs anyway.
Hey.
So if you want a hug from Dr. Julian Kaplan but want to find out more information or even book an appointment, please go onto myfacemybody.com, ask a question to Dr. Kaplan.
Hi, I'm Danielle Lynn, and I am here with Mr. Alan Bosham, and he is one of the top eye surgeons in the UK, and I am so excited. I saw you in the magazine, the article, and I have to tell you, it's such a personal, I think a personal surgery, and very scary for people to do eye surgery. And after looking at just one image that you brought forward, I felt like, wow, to be able to see that clear would even be amazing to me. So I know you have an animation that you're going to show us. So thank you for being on the show.
Thanks very much for having me, Daniela.
Yeah, so what have you brought to show us, and tell us about the kind of work that you do.
Sure, so I specialise in laser eye surgery and lens implant surgery for vision correction. And it can be used for anyone that has nearsightedness or farsightedness or astigmatism or that's developing problems with reading vision. It can also be used for people that have got a combination of these problems. And like you say, people are understandably nervous at the idea of having it done, but it's an incredible operation for these people if it's done by the right person with the right technology. and very liberating. People no longer need glasses and contact lenses and can get on with their day-to-day life without needing any of that, with perfect vision.
Has it changed? Because it seems years ago you couldn't do the same things.
Yeah, it's changed enormously. So people first started to do a lot of these techniques in the kind of late 80s and early 90s. So we have at least 20 years of data and research and understanding to know that it's safe, to know that long term there are no problems with it. But the technology has increased enormously, especially in the last 5 years. And so the technology that we use in order to deliver laser eye surgery is like never before. It's like space age technology, basically, and it allows us to achieve fantastic results.
Okay, let's take a look.
So the procedure is completely painless. It normally takes about 20 minutes to do both eyes. And the first thing that happens is that a tiny, very thin flap is created in the cornea. I use a laser to do this, so it's very high precision. It's 1/10 of a millimetre in thickness, so you wouldn't be able to see it with the human eye. And it's just gently reflected back and out of the way. And then underneath, a second laser will reshape the cornea in keeping with the patient's prescription. Typically for a patient that's -5, the laser I use takes about 25 or 30 seconds to do this. And we then put the flap back into position and it's all done. We move on to the other eye. The next day, patients have 20/20 vision or better in almost all cases. And nowadays, people now talk about lunchtime laser eye surgery or lunchtime LASIK, so they can have the surgery in the morning, be back at work in the afternoon.
It's unbelievable to me. Okay, thank you so much. I'm excited and I want to learn more about it. And if you want to learn more, you can go to myfacemybody.com.
The Stephen Handisides show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.
I'm Danielle Lynn, and I'm so glad you're here. I'm here with Dr. Amar Khan from the Harley Street Skin Clinic. And you know, every time you're here, I feel like I walk away with so much knowledge. And you said, this is it, this is the piece. So we're talking about acne. And whether you have acne or not, there's no way that you haven't seen the pain in a child or somebody that grows up and then they have inflammation on their skin. This is the one that really hurts. So talk about it, because you said this is really a medical condition, but it's hormone related. What do we need to know?
Sure. I think one of the issues we have is that it's so common in adolescence. It's a hormonally driven condition, and it's due to inflammation within the pilosebaceous units, which are the sweat glands.
Is it natural? When you say hormonal, the teenager starts to have this breakout in the T-zone. And there goes, oh, he's just a teenager. Is that true, or is the child or a young adult out of balance somehow that it shouldn't be?
No, they're not necessarily out of balance. There may be a genetic predisposition to abnormal activity of the glands, but the majority of people get it. About 80% of the population will suffer with acne to varying degrees. Acne itself isn't a problem. It's the scarring and disfigurement it can leave behind that can become a real problem.
So from your perspective, looking at products and trying to figure out, we keep talking about the cocktail since we're in a bar, but what do we need to know, whether you're an adult or a child?
If you're a child or an adolescent, then it's important to keep the skin working properly. So AHAs are so important in your cocktail.
Alpha hydroxy acids.
Absolutely. What they do is they break down the plugs of keratin within the pores, which contribute towards acne. If we can keep the pores open and decongested, then you're less likely to get the inflammation.
So is it about a ritual? Is it a cleansing, a toning? What's the ritual that you'd need?
I think the ritual is to cleanse properly and to exfoliate, and to use products like salicylic acid, which is one of the beta-hydroxy acids, to reduce the amount of sebum being produced.
And will we find that in these kinds of products?
That's in these sort of products.
Over the counter, any of these products, I mean, if you look at these, or we can go on the shelf, pick this up, and you're still okay. You don't have to have a prescription.
Yeah.
Okay.
And certainly this product and this range was developed back in the 70s because of people's recognition of acne being a problem. Dr. Yu and Dr. Van Scott developed the Neostrata range, and they were using AHAs then. And all the other products have really grown from that. The adult acne is a different animal, because that could mean an abnormal hormone level or a genetic predisposition in women particularly, and a medical assessment should be done for them.
All right, so Again, we're talking about things that are really important, and a medical assessment. Talk to your doctor. Don't just walk in and make decisions when you're coming to something so critical. And if you want more information, go to myfacemybody.com. We're glad you were here.
I'm here with international yoga instructor Amanda Fowler, and we're going to be doing some yoga today. I've been looking forward to this part of the show and getting involved.
Steve, I don't know, wearing that?
I can't
Where's
get
your lycra?
Well, okay, maybe I'll let you get on with it. So what are you going to demonstrate to us? What are the benefits of yoga for vitality?
So yoga for vitality, today I'm going to be doing some inversions. So inversions are good for vitality essentially because you're reversing the effects of gravity on the body. So the blood flow is rushing to the top of the head. You're reoxygenating, re-energizing all of the cells and the organ systems throughout the body, and plumping up the skin and freshening and livening things up.
Great, I'm looking forward to watching. I am very unflexible, so I am going to let you crack on with it. And
Fantastic.
yeah, enjoy.
Okay, so I've got two inversions for you today. So the first one is going to be Adho Mukha Savasana, which is downward facing dog. So we begin on all fours. So we've got our hands directly underneath our shoulders to begin. From here, you're just going to start by tucking your toes and then pushing through the palms of your hands, all 5 fingers nice and wide. You then start to lift the knees up off the mat, shifting your tailbone nice and high up towards the ceiling, and then externally rotating your biceps, so allowing your armpits to face one another, making space in your back and your shoulders. Taking a deep breath in, extending through the spine, opening through all of the vertebrae, allowing that blood flow to rush through to the face, and allowing your belly to come right up under your ribs. Heels sinking as far as they can down towards the floor, giving you your nice grounding effect. Then we just slowly come down from there, bringing the knees to the floor. And my next posture is going to be a tripod headstand. So to demonstrate this, we do it in variations. So to begin with, you've got step 1, which is just feeling the crown of your head on the mat. So you bring your palms nice and flat towards the floor. You want a nice right angle happening here with your elbow nice and tight in towards your waist. Okay, so this might be you. You might just want to stop here. If you want to come further and you're feeling okay with the crown of the head on the floor, you then tuck the toes and lift the knees up. That's step 2. You might want to stop here if you want to come further, a little bit more for you. Tailbone comes higher towards the ceiling. Elbows stay nice and strong through the triceps and the biceps. And then you start to bring off one foot, then the other. And then if you want more, all the way up, using your abdominals for control, pressing evenly through palms of the hands. And just allowing that blood flow to stream all the way down to the head, calming down, of course, nice and slow, down onto the knees, and you always want to make sure you bring the forehead back down towards the floor, back down towards the floor, and allow that blood flow to even out. We come slowly back up. So for more information, or if you'd like to ask me any questions, you can go to the My Face, My Body website.
Welcome to this part of the show where you can ask your burning questions to our leading experts. I have with me today Dr. Hitan Pabari and Wayne Joyce. Now, welcome to the show, guys.
Hi.
I'm going to start with you, Hitan. Obviously, a smile is more than the cosmetic part of it.
Yeah.
What in the article in the Ultimate Beauty Guide you wrote about dental implants and the important function of those. What sort of are the typical patients that you're seeing in your practice?
Well, most of the patients are 55 plus, and they want something that they feel is going to make them look more attractive and more confident. And with the men, they're normally like driven by aesthetic needs. So if someone in their family's told them, you know what, that tooth missing really doesn't look too nice, can you please go get something done about it? And then the female patients have normally been putting up with the gap for a long time, and they really would just want to do something about it.
So the men, men always seem to need a nudge to get anything done.
Yeah, the men need a kick, you know, to get there. But when they're there, they're committed. You know, they really want to get it done.
Great. And is it a complicated procedure?
It's a fairly simple procedure because implants have been around for a long time now, so we really have a lot of evidence. We know what we're doing. It's not very painful, and it's a fairly quick procedure, and it's really common these days.
Okay. Well, I've got two questions. One is from Lauren from Cardiff, and she said she's frightened by the look of the implant.
Okay.
And does it hurt really?
Well, the implant maybe doesn't look very pretty when you look at it when it's out of the packet, but it doesn't hurt. It's a local anaesthetic procedure. Takes 20 minutes, and it's very quick and simple.
Because it does look quite scary because it's getting screwed in. It's like getting the screwdriver out.
You know, it can look really scary, but what really surprised me, some patients sometimes say, "Can I see it before it goes in?" And you're like, "Okay, I'll show it to you." But it can look very daunting, and the whole thing is a daunting idea. But once patients have had it done, they're normally like, "I can't believe it was so painless and so quick."
Well, I've got one more question. It's from John Morgan from Newcastle, and he tweeted, "I know it's an expensive treatment. Do companies offer payment plans?"
Yeah, this is something that a lot of patients are scared about, is the cost of the treatment. But we can normally break it down over 2 or 3 years and break it in really small bite-sized chunks and make it really affordable for everyone.
With Dr. Hitton Pabari, it was all about putting things in, but with Wayne, it's all about taking things off. Not your clothes, obviously, but now you're a laser tattoo expert, tattoo removal expert. So tell us a little bit about the technology that you're using.
We're using this brand new picosecond laser which can remove a multitude of colours, and it's ultra fast, therefore reducing the detriment on the skin.
It seems like more people, younger and younger, are having tattoos. So what are sort of the regrets that people have when they want it removed?
The biggest regrets are generally the tattoos that they rush into, and then obviously you have the obligatory offenders like your ex's names and things like that. You know?
Yeah. Have you ever fallen to that one?
Not yet.
In terms of the technology, I mean, has it changed in terms of what you can actually remove with the
Definitely. There used to be difficult colours to get rid of, and now they're very achievable with this new machine.
Great. I mean, we've got a question here from Rob from Glasgow, and he said, will the laser tattoo technology work on a multicoloured tattoo?
Definitely. You know, you're looking at greens, purples and blues, which were very difficult to remove in the past, and now they're very, very achievable with the new machine.
And in terms of the length of time someone can expect before the tattoo is completely removed, what's the realistic sort of expectations on that?
Variables from the type of tattoo. There's the age and density and colours of the tattoo definitely affect the achievable results.
Yeah, so would you say they would need to come in for, is it 2
Definitely
to 4 treatments?
Yeah, consultation first, and then you'll be able to assess how many sessions it could potentially be after that.
And is it something which is quite expensive for people to consider?
The new technology is a lot more expensive than current standard tech.
Yeah.
But it is affordable.
Well, I've got just another, there was a tweet from Karen, this is quite interesting, she says, is it as painful having a tattoo as it is removing it?
It's about the same pain threshold, different registration of the pain that makes it a little bit more uncomfortable.
Yeah, and you've obviously had tattoos, and you've probably, have you used the technology yourself?
Yeah, definitely. All on my arms over here are my own walking advertisements.
Thank you so much for coming in. If you want to find out any more information from any of these treatments that we've discussed, you can either go onto myfacemybody.com. We do have the Ultimate Beauty Guide where you'll see their articles, which you can read further, and you can download your free copy on the My Face My Body website.
The Stephen Handisides show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.